welcome back to the State of Healthcare podcast, or the SOH as we're calling it. Last season, we learned about things from the health provider's perspective. So we learned about our system and kind of some of the frustrations of why it's not necessarily broken, right? It's just doing what it says. We treat and treat. We don't necessarily try to prevent illnesses. We don't try to be proactive for patients. So unfortunately, what we've led to is a system that's not necessarily servicing or providing the actual care that it's supposed to be doing in the first place. This season, we're going along from the journey as the patient perspective. So I'd like to kind of combo. If you haven't listened to season 1, always go on back. But what we're going to be learning is what can you do as a patient? So here we're going to be exploring various conditions, some common, some not so common, and what the people have gone through on their journeys from here. So join us this season as we learn what you can do as a patient to take your own healthcare into your hands in the state of healthcare. Hi, and welcome back to our next episode of the State of Healthcare. So we are continuing our series of discussing the patient perspective of things. So again, kind of covering different conditions that people have or that go through or things that to kind of learn from there. So today we're going to be talking about what we call as terrible as it sounds, like saying a common condition, right? There's nothing common about anything that a person experiences, but I'm gonna you've seen Trista before in the healthcare side of it, and now she gets to talk about the patient side of it. So I'm gonna kind of let you talk about your story.
It's finally about me. No.
Oh, touche. Yes.
No. Okay, well, back pain. It's something I deal with every day. For me. I've had it kind of since like 25 is when it started, and I'm 39 now, so yeah, long time. Yeah, it's just something that I deal with on a daily basis. So there's like a functionality aspect to it, so I'm always trying to make sure that it stays at that level so I'm able to do the things that I can do and not be incapacitated by the pain, because I have had that happen a couple times, which is kind of how that injury started.
So what was the initial injury then that happened? Or was there something you were just like, oh, my back's hurting, what happened?
So actually, to take it back even further, then I've always had like issues with my back, even as a kid.
Okay.
So I started having back pain when I was a kid in like my upper back, and I told my parents about it, and then they had me go and I saw like an orthopedic doctor.
Okay.
And they said that I had like a couple spinal like deformities, I guess. So like up here, my upper back is curved.
Okay.
And that they said was because the discs did not like grow evenly. So they created like little arches, so it's curved that way. So that, and then there is I think they said there's some mild scoliosis, that, and I think my pelvis might be a little tilted too. So nothing crazy, but I think just to start, like it was a little bit
spine
kind of wonky anyway.
Yeah.
Yeah. And then, but so I would go to that doctor periodically. They would measure my spine, and they always said like if it got a certain degree or whatever, that they would maybe do an intervention, and I always secretly hoped that it would, so that I could have a nice straight back.
Okay.
Not knowing like all
what
the things,
terribleness of the intervention would be.
Yeah, before having any medical knowledge. But it never got to that point, and then I was basically fine. Like I think once I matured and grew up and stuff, I think it was like a lot of growing pains with that. And then when I was 25, I was a massage therapist, so I didn't have issues so much with my hands. People would always ask me about that, like, oh, aren't your hands sore? And I'd be like, no, not too bad. But it was all the bending at the waist, the hinging. And then one day I went to get up and I didn't feel anything. And I was like, I literally cannot get up. I can't stand up. And then like, I don't know if that was just the adrenaline, because I literally felt nothing. And then a minute later, it was like somebody just took a sledgehammer and just like, hitting my back. So yeah, it was not fun. It took like a couple people like icing it, getting me to the chiropractor that was conveniently located next door. They had to like push me on a cart because I couldn't stand up straight.
So you stuck like an L.
I was stuck like an L, like this. And then they got me there after icing it, and then they had one of those tables that was able to like help get me up. They adjusted me, and then they put a brace on me, and then I remember like we were just like holding my hips together like this, and I was shuffling to the car. And then I got home, I'm like, I'm just gonna lay on the floor and not get up. And it took like 6 weeks to feel better from that.
Okay.
And then that's when like it slowly got better, but I'm not kidding. Like I was literally walking around like this when I finally was able to walk. It's awful. I didn't know how long it was going to be like that, if not forever. And then, and then I did some hot yoga and that helped tremendously. And then it got better. And then kind of after that, it's like this injury that doesn't really ever go away. So like I'm always in some degree of pain, but I don't really think about it. But then I'll have flare-ups of that where I've had a couple times where it's like, oh my God, I'm gonna get these spasms. It's like the worst pain ever. And then it's just kind of like I don't want to get to that place. So then when I started seeing you is because it went from like I would have just flares of this back pain to where it was like becoming more and more constant, but like not a mild kind of pain. It was like a really bad type of pain where I was having trouble getting up in the morning, getting out of bed, getting dressed, all those things. And that's when it started to make me more worried. Like, is this like a downward thing that we're now entering and it's just going to be like this forever? Like, what's going to happen?
Right.
So, yeah.
Had you done physical therapy prior?
Nope. Never did physical therapy, lots of massage therapy because I did it, but also just like tons of massages, trigger point stuff on myself, stretching. But never did actual physical therapy. Chiropractors, stuff like that. Yeah.
Well, not to be self-gratuitous, but we'll get back to it. What is the biggest thing you feel like you've learned from therapy? I mean, there's the journey continues, but like, what has like therapy taught you, or like, how do you feel like from a back perspective or whatever?
Life changing.
I know I pay her to like all this money to come on and say these things, but
no, 100%. So after our first like session, I went to work because we have physical therapy in the hospital, right? And I went up to like every therapist that I saw, and I'm like, thank you, like you guys are amazing. I'm serious, because I just didn't realize like what you actually really did. Like I know you like help people walk again and stuff like that. I see that end of things in the acute care setting, but I didn't realize. I felt like I've been doing everything wrong with my body for like years, which is kind of what we figured out probably is what happened, right? So I have degenerative disc disease now in the L4, L5, so like right where you bend, which is where that injury happened. But I think it might have just been from like that initial injury and then like years of misuse and compensation. So that's like the biggest thing that I learned was like I'm moving incorrectly. Like you were the one that told me that your body's going to get to where it wants to go. It's going to find a way, right? So if you need to bend over, it'll bend over, but you're using all the wrong muscles and things and causing more injury and strain. So I just learned, I didn't realize like, oh, I need to like, use my core. I thought using your core just meant sucking your stomach in. I didn't know like actually how to activate it or, to like use your glutes or do different things. I didn't really think about any of that at all.
Well, and so PT wise blurbs, all the things, right?
Yeah.
So L4-5 and L5S1 are usually some of the most common ones. A lot of people coming in will have issues to that area. So again, like kind of right around that tailbone area. So that's those joints get worn down a lot, right?
Yeah.
And so it sounds like you starting your world had like these other spine things that maybe set that area up. And then massage is hard. Like this is, I mean, you pick two professions that are hard on your body. So like nursing and massage, like there's a lot of bending over, and that's why healthcare practitioners I think get worn down a lot too. And so I think that's the hardest part is like your body is like, okay, I'm mad about this. And then it'll keep telling you later, like, okay. And that's why you have those moments where it does get stuck. And then it keeps giving you those little warnings, which was probably why at that cycle where you were starting to have that pain almost daily, right? Your body's like, okay, so I am excited that like, that's helped kind of engaging the things. I feel like a lot of times engaging your core is just given as a cue a lot of times, and most people don't know what that means, right?
Yeah, I feel like I've heard that my whole life. Oh, engage your core. And I'm like, okay, I'm sucking it in. That's not exactly it,
Right. You're like, I'm trying to engage. So, I guess for you, like for work wise, like how, like obviously, like we were talking about like if you have a day where you have to take an ibuprofen, right? Like
Mhm.
it's life changing, right?
I
Like
love
I feel
ibuprofen.
amazing,
So
yay!
good.
But I remember you saying at one point, you're like, it never occurred to me that there was a possibility that I wouldn't have to have pain every day.
Yeah. That it would like that I could maybe never not be
Yeah,
in pain.
or like that it felt like in your world that there was never a possibility that you wouldn't have pain, or like it just had become such a like everyday, and it obviously it still is, but like
Yeah. Well, yeah, because I guess I was just getting really
mhm,
frustrated, like there's so many things that
mhm,
I've been wanting to do, like
mhm,
especially as a dancer and like that end of
mhm,
things that I felt very limited.
mhm,
And yeah, I kind of was like, well, I guess this is just how it is.
mhm,
So to see an improvement start to happen, and it's not like gone or anything,
mhm,
it's always there. But I guess what really was worrying me is like it was getting progressively worse. It's not
mhm,
getting worse now. I'm actually getting way stronger,
mhm,
and it's there, but I'm starting to feel different kinds of pains now, as like I like not like the back is
mhm,
there, but now it's like,
mhm,
oh, my knee's bugging me, or oh, this muscle is cramping, or different things like that, which
mhm.
I would rather that than it all just be that
That
one.
constant back
Yes,
pain.
yes.
Mhm,
And I always have that fear of it getting to the point like it did when I first injured it,
mhm,
because I have had flare-ups like that. Not I don't think I've had
mhm.
one quite that severe, but I have
Okay.
had some where it was really bad.
Mhm,
And so that's always my goal, is I just don't want to get to that point.
mhm,
So which is good. I feel like if I continue
mhm,
down this path, I hopefully won't have that happen.
mhm,
But I've kind of accepted like I'm always gonna probably have some degree of
mhm,
issue there, but as long as I'm able to function and do the things and not get worse, like that's all I can ask for. Cause I mean, it's not like it's ever gonna, maybe it will be, but
mhm.
if not, I'm okay with that. I've made my peace.
Well, and so I get to I was being my interjection. So from a PT side, it's interesting because I feel like I'm always like the bearer of bad news. Like,
Mm-hmm.
okay, you have this condition. This will be with you for the rest of your life.
Mm-hmm.
We're going to teach you how to work with it to prevent it from getting worse, to
Mm-hmm.
make you as strong as possible,
Mm-hmm.
to get you to do everything functional that you can. And my goal is obviously I would like less pain, but I'd also like you to be able to still do all these amazing things. And like,
Yeah.
so I keep seeing progress and things like that with it. So it makes me excited. And I'm like, we can do all these things. It's going to be great. And I feel like, I don't know. I'm always still optimistic of the things, but from a PT side, we do often have to tell people like this is something you will have to deal with,
Mm-hmm.
but let's figure out how to make it manageable. Let's get you back to stuff that you enjoy. Let's make sure you can dance and not have problems more later, right? So,
Yeah.
or let's get you some of these skills. So, um, I would just out of curiosity, in your like even just in your department, how many of the nurses there are experiencing back pain? Like, mhm,
Lot like everybody. I'd say back pain and
mhm.
depression and anxiety are probably like,
The things that yeah.
yeah, I think so.
Mhm,
We always talk about all the things,
mhm,
but I think that's probably everybody too, not just healthcare. I mean,
mhm,
of everything you do, just sitting, honestly, and that is the thing that
mhm,
actually bothers me the most with my
mhm.
back. The more physical I do, the better
Uh-huh.
I actually feel. So
Okay.
like days where I've taken like multiple dance classes, I actually feel the best like when I'm
Okay.
moving and doing things.
Mhm,
It's when I'm sitting that I struggle. So like when I was still in nursing school, sitting in lecture, I would get out and I'd
mhm.
like walk out of there like I'm 80 years old, like because I'm
Oh,
stiff and
mhm,
stuck. Driving, when I get out of my car, like I'm stiff.
mhm,
Those are the things. Sleeping, if I sleep, like if I get one of those nights where it's like, oh, I got to sleep like 10 hours, rare
Then you're
occasion,
like, oh God.
I'm very stiff. Yeah, that's where I
Mhm,
struggle actually. But like the more physical I am, the better I
mhm.
feel. So yeah, I don't
So
know.
movement.
Movement helps
Mhm.
a lot.
Okay.
Yeah.
Which again, I feel like is a constant theme. Like even just for whoever I've interviewed, it's been like you need to move.
Mm-hmm.
Like
Yeah.
sitting is the new smoking is
Yeah.
the phrase now.
Yeah.
So because so much of it, like, well, fortunately, again, a lot of mine is bouncing around and doing things. So I'm
Mm-hmm.
not as worried. But if I have to sit and do work on the computer, if I am driving for a long period of time,
Mm-hmm.
like that's when my body's like,
Yeah.
what?
Yeah. And actually,
Mhm.
so like at work, my body doesn't really bother me that much because I'm
Mhm.
running around for 12 hours. We do
Mhm.
sit, here and there to chart, but honestly, I'm up and down. Even if I do sit
Mhm.
down, I'm back up running around. It's
Mhm.
on those days when I work, I'm in the most pain when I wake up in the morning, getting ready to work or
Mhm.
getting ready to go to work, and then driving, even though it's not that bad of a drive. When I
Mhm.
get out of my car in the morning to walk to work, I'm kind of struggling. And then as I'm walking, because it's kind of a long walk from
Mhm.
where I park to where I go in and go upstairs and all that,
Mhm.
by the time I've done all that, it's like I don't know, 7-minute walk or something. I feel better.
Oh, nice.
Yeah.
Okay.
Yeah. So it's definitely the
It's
movement.
movement.
Yeah.
Okay. Well, and so you didn't actually get a new MRI until this last hit.
Yeah, I never had one before.
Mhm.
I've had some x-rays and things like
Mhm.
that in the past, and I actually fell off my lollipop a
Mhm.
couple years ago and got x-rays because I thought I
Mhm.
had tore something, and I've had like injuries with competition and
Mhm.
different things like that. But yeah, I know, so those are all kind of separate. Although I was very worried when I fell off my hoop and I was like, oh my God, my back was already messed up and now I've
Right.
fallen on it again,
Uh-huh.
but thankfully that was okay. But you always worry about that because this is me at my baseline having problems, and then
I
if I
know.
do something
Mhm.
else, yeah. But no, the MRI I got because like I said, it was getting progressively worse
Mhm.
in the mornings. Like it would take me a good hour or so to
Mhm.
like feel somewhat normal, and it was getting
Mhm.
progressively worse. So then of course I'm on Google, like what is this?
Why
And
is
then
there something wrong with me?
yeah, and I thought it was
Uh-huh.
like, how do you say it? Ankylosing spondylosis. I
Spondylosis,
thought that's what I
which
had.
is bamboo spine, right? You're
Yeah.
freezing up, so nobody wants that.
Yes. That's what I thought was
Mhm.
happening. And so I was really worried about that. I was convinced that that's got to be what this
Uh-huh.
is. And so my one of my best friends, actually, her sister works for a spine doctor. So I was like, we were talking about our back issues and stuff. And she's like, oh, you should go in and
Mhm.
see this doctor, and then see what you can do. And I went in there and I'm like, I want an MRI. Like being a
Uh-huh.
nurse, I'm like, give me what I want. I
Right.
want an MRI. This is why I think this is what's going on.
Mhm.
And he was like, okay, yeah, let's do it. And I'm like, I don't care if insurance covers it. I just want
Mhm.
it done, which by the way, it's actually cheaper, which is weird to
Uh-huh.
not have, at least in my situation, it was cheaper to not have insurance pay for it.
Oh,
And for
interesting.
me to just pay out of pocket, it was really weird. I don't understand our healthcare system.
How not and again, how much did that end up costing you?
I think it was like maybe like 200, might have been less. I'll tell you what, to see the spine doctor and just
Uh-huh.
have a visit was way more money than to actually get the MRI.
So that's interesting because
Hmm.
I just interviewed someone and we talked about how she paid for her own MRI and it was
Hmm.
like 300 or
Yeah.
300 to 500 bucks or
Yeah.
whatever. But you think thousands, right?
Yeah, well, and I guess
Mhm.
it also too,
Mhm.
it's going to depend on what
Mhm.
imaging you get done, right? So
Mhm.
they only did well, I think actually take the back. So I got the MRI,
Mhm.
and then I think they did do
Mhm.
an X-ray of my right hip because I was
Mhm.
worried about the hip issues there, and there was
Mhm.
nothing that they saw there, which I was surprised about.
Mhm.
But the MRI, it was just I think it was just lumbar spine that they did.
Okay,
So
so
I
you
mean,
just got a low back MRI
yeah,
essentially with not
yeah.
any
So if
special dyes or.
right. So if you got
Mhm.
like different views and cervical and like all that, it would probably be
Mhm.
way more,
Right.
which yeah, so the MRI wasn't bad, by the way. I know a lot of people. So that
Mhm.
was interesting from my perspective as a nurse because I see
Uh-huh.
so many people go and get an MRI and it's a big
You've never
deal.
had
I
one.
never had one before, and
Mhm.
I was like, that's not that bad. It's noisy, whatever.
Right.
But I was
Unless you're claustrophobic.
right. Actually, my biggest fear is because of the braces. I was like,
Oh, the
are my
metal.
teeth gonna fly out of my mouth?
Uh-huh.
So I asked them, I called like Simon, I forget who I went
Mhm.
through, Simon Med or somebody. I called them, they're like, shouldn't be a problem. I asked the doctor, he's like, shouldn't be a problem. I asked the chiropractor, I asked like every person.
Uh-huh.
And then I called MRI at work actually, and I was like,
Mhm.
hey, random question, but
Mhm.
could. And they were like, if they're doing your low back, it's fine. So I was very happy. I still have all my teeth. They didn't fly
Also
out.
valid. You're
Yeah,
like,
that was my
uh-huh.
bigger fear, not being
Mhm.
claustrophobic, none of that. I was just like, oh my God, I hope my teeth are okay.
Well, and it's also interesting because I feel like magnet wise, like it
Yeah,
used to be a bigger
yeah,
thing, but now
yeah, no, it's fine.
So you were able to cover your own MRI, which I think on a level, probably when they bill your insurance, they bill a gazillion dollars, right? And then
Yeah.
for you to actually, if you're just giving cash, maybe it's cheaper.
I think that's what the game is because they want more money, right? So they're
Yeah.
gonna bill it and do all the stuff. So like, so when I fell and hurt my back, I've never like been to the hospital before in my life, thankfully.
Aside from
other than work, I'm at the hospital all the time, but like for myself. And so I originally went to urgent care because I'm like, I don't know. I feel like I tore something. I know I didn't break anything, but I know it was really, really painful. And so I go there. I'm like, I don't know if I need some type of imaging or what. I just want to make sure because I feel a lot of burning. I know that must be a tear. Like, just want to make sure I don't make it worse. And they were like, well, you need to do imaging and we don't do it here. So you're going to need to go to the hospital. And I'm like, I'm not going to the hospital. It was during COVID. And I'm like, I am not going to the hospital because I fell off a hoop and like there's a pandemic going on. There are bigger problems. Like, I'm fine, like, so anyway, they were like, or just go to like one of those freestanding ERs. They're taking a lot of insurance, because of COVID. So I go and I'm there for like 45 minutes, right? And they're like, you need to get an x-ray. And I'm like, I promise you I didn't break my back. So I'm like, whatever, if that's what you want to do. So we did the x-ray, right? And then they give me an injection of Toradol, which is just like a fancy ibuprofen anti-inflammatory. And then that was it. And I was there for like 45 minutes and my bill was $4,500.
Whoa. Okay.
Yes. And so I know like I was like, I get you got to pay for your x-ray machine or whatever, that part of it. It was like $600, $700. That's fine. I get that. It sucks, but whatever. But then I was like, why is it so much? And it's because the way they do it is they tier you like based off of priority. So like if you went in with like chest pain, you'd be like a higher tier versus like, I don't know, something in the middle, and then like back pain is like in the bottom. So they just, it's like a cluster. So they charge everybody the same amount, whether they do a lot for this person or not a lot for that person. And so that's how it was. And then so when I got my bill, I was looking at it too, and I saw some itemized things on there, and it said IV $450. I'm like, I didn't have an IV. And so I called them and I was like, why does it say that? And they're like, oh, let me see here. And they're like, oh, because you got Toradol. And I'm like, well, no, Toradol's right here is $40, which is crazy. Because if you go to Walgreens, you can get a whole bottle for like $10.
Oh my gosh.
So anyway, yeah, they were like, oh no, that's just how they code it for. I'm like, so you're telling me the syringe was $450, really? That's insane. So it actually made me think a lot about like people that actually do have, something serious and they have to go to the hospital. It's like
their bill.
Yeah.
So here's my like insurance soapbox. But so as much as I pick on insurance companies for the way they do things, practitioners are part of the problem. So it's this game, right? Which again, we've got to figure out how to break it, but that's the soapbox for another day. But basically, like I remember practitioners saying I bill for a Band-Aid. So they might be billing $20 for a Band-Aid, right? So you got this ridiculous bill that like $4,500 and maybe should be like a couple thousand at the most for her 45 minutes of time. But so they're sending this ginormous bill for which the insurance company may cover like probably $1,000, right? So you make this huge bill. So it'd be like if you came to me for physical therapy and I billed $500 for my time, and then I'm probably going to get maybe $100 from the insurance company. But why can't I just be like, this was $100 and they give me $100? Like, why is that a thing?
Because they won't make their money.
Yeah. So
inflation.
So they inflate it, and then that kind of takes after the insurance, and then the insurance gets super picky, and then they end up like not covering things for people that's actually needed. So it's just this terrible game of back forth where I haven't figured out how to solve it, but like brain's still going. So
yeah, the things insurance does not cover is really upsetting. I see that happen all the time in the hospital. Like we're trying to discharge a patient and they need, like whatever, like one time I had a patient that had like a new ostomy, which is horrible in itself. And then they needed home health for that, which is very important. Their insurance wouldn't cover it. And I'm like, what?
Can you tell everybody what an ostomy is?
So ostomy like is just an opening, I guess. So like if you have any issue with like your bowels or whatever, sometimes they have to create a new opening for that to come out. If they had to do like a resection of your intestines or something like that, and it's necessary. Like, I mean, you'll die without that in that situation. And it's really awful because it's disfiguring and it's a whole process. Sometimes they're reversible, depends, but like there's a lot of learning that goes into that. It's basically a little like your intestines is like sticking out of your stomach and there's this hole that's created, and so you have to have like a like a pouch or a bag over it, and you have to have supplies. You have to know how to clean that, maintain it, not get infection, all these things. And it's a horrible thing to have to go through. Anyway, and then to know like your insurance isn't even going to cover like home health to help you because you have to learn how to manage it. I mean, we teach what we can in the hospital, but like you're gonna go home with that,
and then you're gonna be like,
what do I do? Yeah, and it's actually there's a lot to it because there's all kinds of different supplies and ways to put them on, and depending on how your body is, it may or may not work. It's awful, like. So yeah, that was one thing that I was like, my heart just broke for that patient. So actually, what happened with that was I usually try to be very careful with my boundaries with patients, but on that situation, I told the patient, I was like, you know what? Because she didn't get the home health, she got the supplies. And we tried to teach her what we could, but I was like, you know what? Here's my phone number, like text me if you have, if it looks infected, text me a picture. I'll tell you like if you should go back or whatever, or like text me and if you have questions and, I'll try to guide you through it. I'm like, please try not to call me because I don't really want to do that, but if you want to, but I never heard from her, but like, it was just awful. I couldn't like not, you know what I mean? Let her go like that and not really. So I guess she was fine. She never reached out, but
So the upsetting part about that being, of course, that the insurance would rather deal with like her coming back to the hospital infected, probably, and pay for that, and then they would like about actually teaching the person how to manage it and maybe be okay later. So,
which another thing that's interesting too is like, I don't know, I think there's a lot more to it on the insurance end of things because the hospitals, a lot of times, if you're readmitted within a certain time frame for the same issue, they actually don't make money on that admission. However, I think the insurance company probably does because there's money coming in, you know what I mean?
So it is kind of interesting.
Yeah.
Because again, I don't do a lot of hospital work with things, but I have probably friends that work in the rehab departments and they'll release people, right? They have to follow these guidance from the insurance. So they send these patients out, they discharge them. So these patients aren't ready, right? They're kicking people to the curb that aren't ready because it's an insurance dictated thing just to see them back like very shortly because this person wasn't ready to go home anyway.
Oh, yeah.
And then you're like, well, what good was that for anybody?
We constantly have like readmission. Like, didn't I just have you last week? All the time that happens. Yeah.
Whereas if you could just actually provide the care that you wanted, or that maybe not you wanted, right? That the person actually needed.
Yeah.
And then release them back into the world to do the things, it would be like, as I stray off, I'm like, we're supposed to be talking about you and your back stuff, and we're like insurance, like healthcare, which again, it's called the state of healthcare for a reason. So but for you, I guess my question was, like from the back, like, well, I mean, I can continue going on and grilling all the insurance things, but
that could be a whole
series. That is a whole. That's maybe there's season 3. I feel like coming, but just for your back, like again, now when you get up and you talk about like in the morning, it's this whole like hour routine because so many people are affected by back pain. It's probably the most common diagnosis, right, that people get is some form of back pain. Like, is it still that hour routine, or like what are you doing for self-care, or like like break that down for
well your exercises. So she gave me a whole bunch of different exercises.
That's the best answer.
I don't say that in a no. But no, so that I like to do before bed actually. Probably would be better in the morning maybe, but like timing wise, with work
before bed is perfect.
Yeah, so I do them before bed. I have a whole routine. I have like a little salt lamp that I turn on. I'm like, I don't know, it's a placebo probably, but I'm like, oh, healing, I'll do my exercises. That has helped a lot. And then, yeah, so that's
Mhm.
kind of my routine with that. I'm trying to incorporate more stretching, more regular stretching and stuff.
Mhm.
But yeah, that has been the biggest thing that
Mhm.
has helped. And then of course I love my little
Lacrosse ball.
yeah, I'm like, what do you call, I don't want to just say
Uh-huh.
the balls.
Right.
The lacrosse ball,
Perfect.
foam
Uh-huh.
roll. I do that stuff all the time.
Mhm. All your
Constantly.
mobility stuff.
Yeah, actually put
Trigger
a
point.
hole in my wall from my
You're not the
lacrosse
first
ball.
person to say that.
So I do it outside now in my backyard against the cement, the block
Oh,
fence,
okay.
because I don't trust myself to not put more holes,
Holes in
because
the
I like a
wall.
lot of pressure. Like I
Mhm.
also get a lot of massages, so probably about
Mhm.
twice a month I get a massage, or
Mhm.
depending as needed. And I like beat the beat the shit out of me. Like that's what I want.
Mhm. Deep pressure.
Run
Mhm.
me over with the truck. That's the kind
Mhm.
of massage I like, because I feel like it just, I don't know. I know everybody's different, but, and I've had
Mhm.
so many
Mhm.
massages because I was a massage therapist, and in school every day you got a massage, because
And
you'd
then you
give one and then you would get one and then you would critique and
Mhm.
stuff, which was awesome. Go to massage school. It's pretty great.
Right.
But like, yeah, so I've had a lot. So I feel like I didn't start that way though, with like
Mhm.
pressure and that, I built
Uh-huh.
that up. But yeah, I need that. So I like the trigger points a lot,
Mhm.
the foam rolling. What else do I do? Oh, I do turmeric
Okay.
for inflammation when I remember. I don't do it
Mhm.
like all the time, but that as part of the routine. Um yeah, just movement, like that is the
Mhm.
biggest thing.
Keeping yourself active.
Keeping active, yep.
Mhm.
And then I try not, sit for long periods of time
Mhm.
or like that kind of stuff. That helps a lot.
Mhm.
So yeah, those are kind of my things. Hot showers.
Okay.
I need to take more Epsom salt baths.
I know, no guilt. I know, like the little crack bags
Oh,
of
and
Epsom salts.
then
Mhm.
inversion therapy helps a
Okay.
lot for that.
Mhm.
So I have an inversion table that I
Mhm.
love. So basically, like, you strap your legs in and you tip upside down. You
Mhm.
don't have to be all the way upside down. You can do, just
Mhm.
something that's gonna take some
Take
pressure
that
off of
pressure off the
that.
joints.
Yeah, and kind of
Mhm.
open up that space. So that helps a lot too. That and
Mhm.
the PT honestly are probably the most effective,
Mhm.
and like the lacrosse ball, that combo.
Right.
But yeah, and then the chiropractor too. So I do that not all the
Mhm.
time. It depends on how I'm feeling. Like sometimes I'll be feeling better, so I don't go as
Mhm.
often, and then other times I go more frequently if I'm having an issue. And then she does inversion therapy too. Hers is different, so you don't
Mhm.
have to be upside down.
So
You
like
be
one of
able
those traction
Yes.
tables, like
And then you
okay.
do that with your portable one, which is really
Mhm.
cool. I kind of want that device.
Yeah, you can strap yourself in at home.
Yeah, super cool.
Mhm.
So yeah, I think those are main things. Ibuprofen once in a while, but I
Mhm.
try not to abuse that because that can be an issue with want to stomach bleed or anything.
Pick your organs you don't mind
Yeah,
losing. Yes.
yeah. So yeah, those are the main things I guess that I do. Once in a while, ice
Mhm.
or heat.
Well, my question is, what would your goals be for your back pain, if any? Like, all things are possible. Like, what would you pick? Like, I want to be able to do this. I want to get up in the morning and touch my toes without problems, or I want to be able to dance without pain, or like, what would your back pain goals be?
Hmm. To number one, not get worse.
Uh-huh.
Definitely.
Mhm.
And the morning stuff does suck, but like I would
Mhm.
actually rather be able
Mhm.
to do more of the dance and like fitness goals that I
Mhm.
have, because that does limit me a lot at times.
Mhm.
It is much better now though. Now that I've learned correct techniques and
Uh-huh.
activating the cores, I'm serious. Like that stuff has
Yay.
helped
Okay,
so
good.
much,
Yay.
so much.
Mhm.
Um, I've gotten a lot stronger with like pole. I do pole dancing and stuff like that. So
Mhm.
yeah, that
Mhm.
definitely I've seen a huge you know difference there, because for a long time I felt like I just was not progressing in any of
Mhm.
that stuff, and I felt like my pain was limiting me a lot.
Mhm.
So yeah, I would say not get worse and be able to do more of the things that I love in the morning. Like, yes, it sucks, but
Uh-huh.
I almost have kind of accepted like that's just kind of part of this, because I don't, not to be negative, but
Mhm.
I don't have like unrealistic expectations either.
Mhm.
You know, it's a chronic condition. I'm never going to get the space back in my
Mhm.
back of where, you know, there's no cushion in between those vertebrae. You can't like magically get that back. I wish you could.
If
And
you could, you'd be really rich. If you
yes,
had that
yes.
procedure,
And maybe in the future that will be a
right?
thing.
I feel
Um,
like, yeah,
yeah.
maybe.
Yeah. And I mean, I guess you could get injections too.
Mhm.
But and they offered that to me, like if I wasn't
Mhm.
able to do physical therapy, like if it was too much pain, you know,
Mhm.
that they were like, well, maybe you could do injections to get you through that, to get you
Right.
stronger. But I was like, I'm not to that point, so
Mhm.
I don't really want to inject anything anywhere that, you know, because
Right.
that poses its own risk. I mean, I'm all for it if it's necessary, but
Mhm.
I was able to do it without that. So yeah, just don't want to get worse.
Well, and that is a degenerative disc is basically like you've worn down that like
Mm-hmm.
that cushion in
Yeah.
there.
And I was like, why do I have this at 39? You know,
Mhm.
like that seems, I feel kind of young for that. I
Mhm.
feel like that's a older people problem. But yeah, I think it's the consensus was kind of just that
Mhm.
that initial injury or injuries or whatever, and then, you know, incorrect technique compensating
Kind of wore down
wore it
those.
down.
And again, I see a lot of people of all ages that actually, unfortunately, have worn down things. A lot of times it's repetitive stress. Sometimes it's like the setup of like
Mhm.
the luck of the draw with the
Yeah.
spine,
Yeah.
you know.
Also, too, another thing that I think a lot of people can work on, and I know it for me as well, like the back or knees or whatever,
Mhm.
is weight. You know, you carry extra weight, that's extra
Mhm.
stress on your joints and stuff. So that's another thing that I am trying to work on, you know,
Mhm.
and not saying like oh, like, you know, fat or anything like that. But I mean, it's true. Like, if you have extra weight, that's extra stress that you're putting on your
Mhm.
joints and stuff. So that's another thing that I was like, well, if I was a little bit lighter, it would probably make everything a little bit easier, you know, not as
Mhm.
painful. So that's another thing that I'm in the works of doing to fix and promote, you know, health wise. So
Well, and that's also like
no
so.
one wants to say that one, but it's true. It is
No,
true.
and that's the hardest. When I was an intern in the hospital, I used to have a instructor who'd be like, "You need to go in there and tell them they need to wait because they're too fat or
Hmm.
whatever." And I'm
Hmm.
like, I don't say that with patients. If
Yeah.
I usually like if someone asks me, I'm like, yes, if you had less weight, you would put less stress on your joints.
Hmm. Yeah.
So, but in the meantime, we focus on just strength building and trying to do the steps so that the muscles could take
Yeah.
over from there.
Yeah.
But
And then if you get
mm,
stronger and have less pain, then you can move more and then you probably will lose a little bit. So
right.
see, it's a whole
Hand in hand,
hmm
but yes, you are correct. The less weight that you carry, the less stress to all of the joints.
yep.
You know.
And wear and tear. Yeah. So yeah.
So there's all yeah, but you know, so again, as healthcare practitioners, we often have our own things that we're fighting and confronting, and as we're trying to negotiate the system, a lot of times taking care of ourselves is probably the lowest thing on the list.
Yeah. No, it's true. Until it starts affecting you on a
Mhm.
level where you're like, oh, this is a problem, you know? So
Mhm.
yeah. I'm much more vigilant of it now. Once
Mhm.
I kind of got scared, like
Mhm.
scared straight, like I better.
Right. So it was probably that moment where you're like
Yeah.
seeing, and again, for some people, so I guess maybe on a level with back pain, would you recommend people like start taking care of it sooner? Or would you
Yes.
say like, you know,
Yes.
mm,
I guess like I just didn't really think about it, you know, and
mm,
I think that's part of it too, is you kind of just accept like, well, this is just how it is. This is my new
mm,
reality, you know, this is what happens when you get older or whatever, but it doesn't actually have to be like that, you know?
mm,
So yeah, definitely address it earlier. I think everybody should, I tell everybody, like everybody should do physical therapy, just like everybody should do like psychological therapy too. Like I'm
mm,
serious. I think most
work
people,
on yourself.
yeah, work on yourself. I'm like I after we started doing our sessions, I was kind of like, why don't they just do physical therapy in school? Like like instead of like
Always
physical
pro.
education, like no, I'm serious. Because I literally felt like I was moving incorrectly my whole life. I'm like, we're literally like learning how to bend over. And I'm like, I've been bending over wrong my whole life. I didn't like all these
Uh-huh.
simple movements that we do every day. I'm like,
Mhm.
I was not engaging my core. I was not squeezing my glutes. I was not keeping my back straight, you know, and it's
Mhm.
something that you do how many times a day you don't even think about it, you know? Or like, you know, if I squat down to pick something up, I'm like externally rotating. I'm doing all these weird things that I didn't even realize until you have
Mhm.
somebody say like, "Hey, I noticed when you," which
Mhm.
is what she does. So, which is really cool. Like,
Mhm.
so having somebody point that out to you and like you do a movement and then, she looks at it, you look at it and say
Mhm.
like, "Okay, I notice you're rotating this way. It should be like this." And you don't even realize it.
Mhm.
Like when I laid on your table
Oh.
or so whenever I lay on a table to get a
Oh.
massage, I'm always crooked. And then so when she was working on me, I was laid down and yep, I was crooked.
Yeah. We're
And
like,
then,
okay, we're gonna, yeah, like, let me see. But
and then when I laid straight, I felt like I was like the
your
other
body's like,
way.
what is this madness?
So it's very weird, like your
Mhm.
relationship from your mind to your body and what is
Mhm.
actually happening versus what it's actually doing, which is a whole other side of things. Like not
Mhm.
only is your body doing what it's got to do to get to whatever thing you're trying to make it do, whether it's the wrong way or not. But
Mhm.
your mind also doesn't really understand. You think you're going this way and you're not, you're actually going that way.
Mhm.
So physical therapy has made me a lot more aware of that too, to
Mhm.
prevent those injuries and to, because I think that's really what a lot of the chronic back pain is. Like, yes, we do things that aggravate it, but I think honestly more of it is probably continuing to like compensate in ways that
Like you were probably unaware of, right?
you're unaware of. Yeah.
Mhm.
So
So, well, no, and it's just like again, I it's kind of like learning where your body is in space, right? So
yeah.
you've learned these other patterns and now your body's like, but we're here. And you're like, no, no, this is where you're supposed to be. And so your body, again, we talked about your body will always find a way to do what it has to do.
Mm-hmm.
It's going to learn maybe a poor pattern.
Mm-hmm.
And then it's interesting because I was talking with another patient about like again, I'm always pro physical therapy at all points, right? Therapy, but and I'm pro also the other type of therapy as well because
Mm-hmm.
mind and body connection.
Mm-hmm.
There's a huge thing with that, and also even just as a side note, when you have chronic pain or when you have these things that wears you down.
Oh yeah. So that's
Mm-hmm.
yeah, that is another thing. So like
Mm-hmm.
mentally, yeah, I was not in a good place, especially
Mm-hmm.
when it was getting like a daily thing like that and getting worse and
Mm-hmm.
worse. I was in a horrible mood and like
Mm-hmm.
very depressed and
Right.
not wanting to do things and all that. Yeah.
Mm-hmm. Yeah.
So just like we were saying, like the more you do, the better you
Mm-hmm.
feel. Like the less you do, the worse you feel. And like if
Mm-hmm.
you're in pain, like you're doing less. And then yeah, it is
It becomes like a cycle.
downward spiral. Yeah.
Which is a side note, this is my one brag moment, not for me personally, but for PT. Just I was googling like professions. I think I
Mm-hmm.
told you that deal with mind body connection, and not that nursing doesn't in any way, so it's nothing. But it was like physical therapy was at the top of the list, and I was like, woo,
Yeah.
just because it is such a you are seeing people that are hurting or doing whatever, and it is so tied into like that just wears on your brain.
Mm-hmm.
And so, but I was talking with another patient about how we feel like a lot of in schools, like even like when you get into school and you're doing like the hitting, like they're doing the weight training or they're doing the whatever, it would really be cool if there were therapists in there helping with that for these kids
Yeah.
learning these life lessons or these skills. But it's not, and you're turning out, and then you go to the gym and you're lifting, so just
Mm-hmm.
obviously therapy everywhere. But
Yeah, and I think when you're young too, like,
mm,
you just think you're invincible and it's never going to happen to you. And you feel good when you're young until you
mm,
don't, until something happens,
right until
which
you're
is,
25 and you're like,
yeah.
what happened? I'm just bent over the table.
Yeah, and I remember being in massage school and them teaching you about body mechanics and make sure,
Mhm.
you keep your knees soft and make sure you bend like this and make sure your table is the right height, which I was very guilty about that. Like I had
Mhm.
my height of my massage table, the one height that I kept it on that was like
Mhm.
worked best for me. And I never made those adjustments and stuff. Now
Mhm.
at work, well, it's nice that like our beds are adjustable,
Mhm.
electronic. My massage table was not. They not that they don't have those now, um but yeah, so now at work I'm very aware, like, oh, if we're gonna move a patient or do
You want to make
anything, I
sure.
have it. Yeah, but back
Mhm.
then I didn't do those things. I was,
You were like in your 20s, you didn't like I can do whatever, and nobody
yeah.
thinks about what your body will be telling you when you're 50, right?
Yeah, so if I could go back in time, I would be like, no, you should, better ergonomics, body mechanics, 100%. And two, like before that injury, I had a lot of warning signs, like I was sore and stuff, where I was like, I probably should get a massage, and I kept putting it off. I was busy or whatever, things going on, and it got progressively worse for a few weeks until it finally just went out like that. So I'm always like, gosh, I would have just like prevented that from happening. Yeah. And then side note on that, like they say that twisting motions are like the worst. Like usually that's right. Isn't that usually?
Well, it's a lot of people plant and then they twist their body, right?
Nice pop.
I know. Like that's why you don't do that. It's terrible. My body was like, what just happened?
It sounded like it felt awesome.
So yeah, you see people like grab something heavy, and instead of taking it like we call it the power zone, where it's all in here, right? You keep it close. They will twist, and now like it's out of your center of gravity, and you're like,
yeah, like so physical therapy could be more preventative than like after the fact. Just like all medicine should be preventative instead of reactive,
right?
That would be great, like because then you would prevent a lot of this stuff from happening.
Have a healthier society. It'd be
soccer,
right?
Like,
we wouldn't be all on the meds and the things and the madness, but again, it's kind of like that is a lot with back pain. So usually the back's been giving you warnings. So that's the biggest thing is I hear from people like that they had those little warnings, right? Then they're like, whatever. And so a lot of times it's like, if I should have just done this a little bit sooner, right? And so that's your big thing. If you're having back issues, take care of it now. It's better to like go in for a sprain strain than it is a chronic back issue.
And that's the thing now that I have this, so I know my body, so I can tell like when I'm like I could flare up with this pain kind of a thing. So like there are times where I'm like, ooh, I better not do that, or I better, and then other times where I like, no, I'm good. Like you can just tell like how you feel, like
listen to your body.
Yeah. So sometimes like I'll be in class or something and we're doing a certain move and I'm like, nope, I am not doing that, because I can just tell if I do that.
Right.
It's already kind of aggravated, and if I do that, we're gonna have a major problem. So so that's what I mean. Like I felt like I had a lot of setbacks for a long time because I felt like that a lot all the time, where I'm like, shouldn't do that, And now it's not as bad, especially with the exercises. And I noticed too, like when I do them consistently for like a week in a row, and I'm like on it every night before bed, I feel so good. But then I get lazy sometimes and I don't do it for like a week, and then I'm like, oh my God, I feel it. You regress, definitely. And then that was a whole pill to swallow too, because then I was like, oh my God, do I have to do all these exercises every day for the rest of my life just to be somewhat normal? But
well, and that's also like I always feel like I've had that where patients are like, I hate doing like, because now it's like, really, I have to do this the rest of my life, and I'm like, well, yeah.
Actually, no, I don't hate the exercises. Honestly, it's kind of like you just have to start doing them. Once like you're like, okay, we're doing them, I'm fine. It's like going to the gym. Like if you just drive there, then you're more than likely going to go there and work out. It's just the thought of actually going there.
Right.
So yeah, routine is probably best. So that's why I like to do it at night, and then you just get on that track.
And I promise they don't have to be the same ones that like forever, right? Like ideally when you're done with therapy, they're like, here's your 3 to 5 things to continue for the rest of your life. But so in an ideal world, that's kind of where you go with it. But yes, unfortunately, the rest of your life.
But you know what? You're gonna have the pain the rest of your life.
Yeah, so you can either choose debilitating pain and loss of function, or these fun little exercises, and that take like 20 minutes of your night, or possibly longer, but like putting out that time to function. So, but I do understand exactly what you're talking about. So that's the hardest again sell, right? So chronic pain, and especially like a back issue, welcome to exercises you get to do the rest of your life. So but also I'm excited to hear on the note that like you are able to do more things. There are less times that you have where you're like, ooh, I shouldn't do this movement, because overall you are functioning better. Which is exciting. So in my head, I'm like, I think it can continue that pathway. I'd like to see where the things go.
I want to age in reverse, like not, because I was like, man, I feel like I already got these old old people problems. Like, and then what's it gonna be in like 10 years, 20 years? If I'm, and that was a legit fear I had. I was like, oh my God, what am I gonna be like at 50 if I'm like this?
If you're here now
and I'm still in my 30s, you know?
Right.
Yeah. So I don't want to be like that. And that is true. Like I always tell people this, like, so you see all these different kinds of patients, right? And I'll see patients that are like in their, 30s and they look like they're in their 50s. Or you'll see a patient that's like 80 and they look like they're 50, and how they react to like being in the hospital and whatever treatments and stuff, that surgeries, whatever they have to go through. And I'm telling you, the people that walk, those are the people that are at 80 years old, like doing stuff still. And the people that sit, they're the people that are, they're 60 and they look like they're 80.
Right. So movement, lots of movement.
Yeah. That's the
message,
theme,
right?
Yeah.
So, well, thank you for taking time again. I feel like we're always grilling into things, and maybe season 3 we'll finally just take our whole episode of like take on the insurance. We'll talk money, right?
Let's rage.
We'll rage. It'll be our rage season of like anti-insurance, anti-overbilling, all that madness. So I think that could be a fun theme.
Yeah, I think so. I feel like I need to do a little research though, because I might be speaking out of pocket on some things, because it's like what I think is happening. Maybe there's more to it. I don't know. Do you know anybody that works in insurance?
Yeah, so stay tuned. We'll get the insurance side of the perspective of it, right?
You will learn something, maybe.
Right?
Yeah.
So we'll weigh both sides of the coin instead of just the healthcare practitioners raging against the system that we fight in. So, but thank you for kind of coming in and talking about your therapy process and
who doesn't want to talk about their back pain? Seriously, really, people always want to talk about their problems and pain.
Well, and again, it's also like, and I hate saying like it's such a common condition, but back pain it's one of the most common conditions treated, and especially in therapy, right up there with like knee problems and shoulder problems. It's like right up there. So I like to have a perspective for people to realize like you can do something. Like, let's clean up what your form is. There are things you can do. Yes, you're going to probably have to do these exercises for the rest of your life. However, let's get you functioning. So
and hopefully not like by taking a bunch of meds every day, right? Which is something we kind of forgot to talk about. Like, yeah, you could take meds, and if you have to, like, that's your thing, you have to, but that's debilitating too in its own way. So maybe your pain is better, but you're knocked out, so what good is that?
Just sleeping the day away. Or
I guess if your pain is that bad that you're that miserable, then maybe that is better in some regard, and maybe some days you do need that, but like overall, what kind of quality of life is that?
Right. So if you only have to take an occasional ibuprofen,
right,
that's not
right,
like that's pretty. I'll take it. So if you're like, I know we didn't even develop into so you've managed to like, I mean, you've dealt with this without having to do like injections and just medication. So I still feel like, despite the fact, like, again, it sounds like you've got a good handle, and of course we're gonna do more physical therapy and it's gonna be amazing, but no. But so again, movement is the thing, and we're gonna do some research and we'll get back to you for season 3. So thank you again.
Of course. My pleasure.
Bye. Thank you for tuning into today's episode of the State of Healthcare podcast. We hope that we were able to gain some valuable information, or at least some insight into what goes into some of these conditions from this patient's story. Again, please feel free to like, always share. Please follow us online at Better Fit Therapy. And again, if there's any conditions or things that we haven't addressed or that you might find interesting, you can always message us online and we'll be willing to investigate. But again, taking your own healthcare into your hands is probably the most important lesson that you can learn from this. So unfortunately, in the state of healthcare that we're in now, you do have to fight for the things that are important. We encourage you to take a more active role in your healthcare and be able to participate so that we can fix this system where we're at now. Thank you again, and have a good day.